Kajala Medical presents COVID-19 The Answers, the show that delivers the scientific, evidence-based knowledge that can safely return us all to our pre-COVID lives. My name is Dr. Fumi Okunola, and I'll be hosting the show. Every week, you can listen to me interview a highly respected professional about the science that can reduce your risk of becoming infected with this coronavirus. Welcome to COVID-19 The Answers. I'd like to introduce you all to Mr. David Morley, President and CEO of UNICEF Canada. He is a prolific international speaker, commentator, human rights advocate and mobilizer with more than 30 years of experience advancing children's rights and sustainable development on the world stage. David has occupied senior positions in some of the world's most respected charities. He has been the executive director of Médecins Sans Frontières, Canada, president and CEO of Save the Children, and now for the past 11 years, president and CEO of UNICEF Canada. Welcome.
Thank you very much, Fumi.
David, can you please tell us about UNICEF and what led you into the world of charitable organizations and children's charities in particular?
Well, I came into this work by accident, I think we could say. When I was doing my undergraduate, I had a work here in Canada, in Ottawa. I had a particular interest in medieval Europe, and that's what I'd been studying, and which of course does not immediately lead to job prospects. And a friend of my family, who was a member of the Ontario Human Rights Commission, was coming to Ottawa. I was unemployed, and my parents arranged for me to have breakfast with him because, maybe I could get a job or something, or he could point me in the right direction. And I'd worked all the summers during university. I'd worked as a camp counselor for children with special needs. And when I told this family friend what I'd done as my summer job, he said, "You have your whole life ahead of you to work in an office building in Ottawa or Toronto. What you should do is go and volunteer at this organization." It was an organization set up by Costa Ricans with Canadian support in Costa Rica for children who've been living on the streets. And so I thought, well, okay, I guess. And I went to volunteer, and I'd been grown up as a middle class Canadian, and I'd expected when I got to Costa Rica to find that these kids would have just been crushed by the poverty that they'd experienced, and life on the streets, and life in pretty Dickensian institutions. And instead, I found here are these kids with an amazing ability to care for each other, creativity, sparks so filled with life, Wow. And so I was going to go for 3 months, and I stayed longer, and it turned into a career because of those kids, because those first kids that I knew. And I mean, now it's very nice because of Facebook. Those kids are, some of them are, this was 40 years ago, some of them are grandparents now, and so am I. So we share notes on grandparenting and stuff. It's lovely, but that's why I'm not a medieval historian, is because of those kids.
And the children of the world are glad of it. What a fantastic story.
I'm very fortunate.
And could you please tell us about UNICEF? What is the organization about? What does it do?
Well, UNICEF began right after World War II, when there was famine and risk of famine in Europe and in Asia and the United Nations. One of the first things it did was it realized that providing support to children who had suffered through those two wars was vital, and that if they were going to have, if we were going to have peace and prosperity in the world, we had to be sure that that care was taken for children. And so we were started before the United Nations was even 1 year old. And as the a few years went by, and the acute phase of the humanitarian emergency in Asia and Europe ended, and the decolonization process started, UNICEF continued to grow to help help situation of health and education and child protection in many countries. And when the Convention on the Rights of the Child was finally passed and ratified a bit more than 30 years ago, UNICEF was named in it. We're the agency named in the Convention on the Rights of the Child that it is our responsibility to protect and promote the rights of children. We're the only agency named in it. And while we know that these sort of human rights treaties and conventions are not are rarely fully fulfilled, the Convention on the Rights of the Child is the most signed and ratified human rights treaty in the world, in our history. So that's what UNICEF's job is, to work with governments and community groups and the private sector and civil society to ensure that, to do our best to ensure that children's rights are protected and promoted, that children they have adequate health care, that they have adequate education. And it's we're in this unique position where we're part of the United Nations, but for us in Canada, UNICEF Canada is also a civil society organization. So we have the flexibility of civil society, and we have the authority of the United Nations, and that gives us our mandate to do what we can for children here in Canada and also around the world.
That's wonderful, David. Thank you for that. So, moving on to our questions now. Part 1. This involves the effects of the pandemic on children. So the effect of the COVID-19 pandemic on children has been significant and in some ways catastrophic. A modelling study published last week in The Lancet stated that globally, 5.2 million children aged 17 years or under had been orphaned due to the COVID-19 pandemic. This equates to a child becoming an orphan every 6 seconds. These figures were calculated by the researchers up to October 2021, and they are projecting that figures up to January 2022, once calculated, will rise to 6.7 million children orphaned. The consequences of this are devastating and enduring, resulting in institutionalization, poverty, abuse, mental health problems, adolescent pregnancy, and chronic and infectious disease. Of the 20 countries in the study, low and middle income countries were particularly affected, though every continent has been touched by this. Also, this is likely to be an underestimate, as the World Health Organization believes mortality estimates show that the African region, for example, has underreported death rates by a factor of 10. This is truly alarming. These results are outpacing global COVID-19 deaths. This is all happening on the back of a widely held misnomer that children have hardly been affected by the pandemic because their rates of severe disease, hospitalization and death have been lower than adults. Though the severity of COVID-19 as it applies to children is beginning to change with the onset of the variants, which we will come back to later. In its 75th anniversary report entitled Preventing a Lost Decade, UNICEF has stated that COVID-19 is the worst crisis for children in its 75-year history and has called for urgent action. This interview today aims to focus on some of the main crises that UNICEF has highlighted directly affecting children globally today, namely poverty, education, mortality, immunisation, nutrition and abuse. David, at the beginning of the pandemic, did UNICEF anticipate children being orphaned on such a mass scale due to COVID? Or was this unexpected collateral damage of the pandemic that you had to account for? Secondly, what measures are UNICEF taking to mitigate and support orphan children globally due to COVID?
Well, I think those are such shocking and sobering numbers, and it's a reminder that for us at UNICEF, we have been saying, we quickly realized that the pandemic, although the mortality of children was lower than that of adults, and we don't know all the results of that, as you're saying, yet, but this was absolutely a child rights crisis, a children's crisis. We know that at the height of the pandemic, more than 1 billion children were out of school, and we still don't know. We don't think that all of those children are going to go back to school. We know, and we'll talk more about immunization rates for children and for poverty. But I think none of us really knew at the beginning of the pandemic how long it would go on for and how devastating it would be. And this issue of children losing their parents to COVID, and then what does that mean for them, is one which I think we had not been ready for. I don't think the world was ready for it. Our work, because we're, as part of the United Nations, a lot of our work, as I mentioned earlier, it's either with local civil society or with governments. So to try and help the children who've been orphaned, we work a lot with ministries in countries all around the world, the ministries of family, the ministries of social affairs, what they may be called. And so we'll be working with them to try and find models of care. If there isn't care for extended family, the members of extended family try to have policies that will give them support. But we encourage governments not to do institutionalization of children, to find community-based responses, which will be a way to care for those children. I think in the vast majority of cases, children will be cared for by extended family. And I think if we even think of here in Canada, when there are tragedies of children who are orphaned, extended family is usually the first to step in. But then we have to be sure the policies are there that will give the support that those extended families need. In a way, the crisis of 20 years ago, when AIDS was having such a destructive swath through sub-Saharan Africa, we learned a lot from all those grandmothers who started caring for their grandchildren. And we've learned about policies that can help with that. And we've learned, those of us who are from outside of those communities have learned the phenomenal strength of those communities. And I think, and I hope, because we're at the early days yet, that we will be able to learn from what happened, the way communities responded, and be able to support a similar response that's going to be needed this time.
Thank you for that really good answer. The following questions are based around some of the figures stated in the UNICEF report and also extracted from UNICEF's website. We will also briefly examine how the Omicron wave has affected children and talk about COVID-19 and long COVID in children. Let's start with poverty. David, to allow the audience some perspective, what is UNICEF's definition of poverty? According to your website, 100 million more children could be living in multi-dimensional poverty by the end of 2021 compared to the pre-COVID era. What is multi-dimensional poverty, and what plans does UNICEF have for addressing multi-dimensional poverty?
The multi-dimensional poverty that we use is it was first developed in Oxford University in the UK, and the World Bank has used it as well. And so it's very detailed, but I'll try to stay high level. There are 10 indicators. There's 3 main dimensions of poverty. When you add in the World Bank, it's less than $1.90 a day. Under the health indicators that we look at, there is the nutritional status and also the rates of under 5 child mortality. So we consider those. Then we look also at the years of schooling and at the country level, and the level of school attendance. So how many children of school age are in school. And then there's a variety for living standards, which go beyond just simple, what's the money you bring into the family. It's what kind of cooking fuel do you use? What's your sanitation? Is it open defecation? Is it latrines? Is it plumbing? Do you have access? How far away is the nearest drinking water? Do you have electricity? What's your house made out of? What are your assets in the house? How much furniture and things do you have? So we look at all of those, because in some cases, people may be earning more than $1.90 a day, but they're not living in an environment or in a region where their children are likely to get a chance to go to school, or they may be living far away from a health clinic. So they've got some money, but they don't have access to health care for their children. So that's why we want to look at the multidimensional poverty index, because it's just a more accurate way to really assess what are the levels of poverty. And then for us at UNICEF, that helps us decide where will we do our programming as well. Because we work in every country of the world, we have a lot of choices that we must make. And this is one of the key drivers to where we will invest our resources.
So with with multidimensional poverty increasing, what plans does UNICEF have for addressing that?
Well, all the component parts of our work we think they will help, and maybe I don't know, maybe we can look at them more in detail, but it's our investment that we try to get in education. It's the investment in community health services so that the child mortality rate will decline. It's the investment that we will make. We also make in where possible, improving the economy so that of a place that things will be able to become more sustainable. But education and health are so important. I mean, we know, sometimes I feel that we take it for granted here because we have access to these things. But those are two of the areas that we work very much. Well, that's much of our everyday work of UNICEF is involved in those two areas, as well as child protection. But those two areas particularly to address the multidimensional poverty.
Thank you, David. children going to, so if we move to education, children going to school or not going to school was an incredibly polarizing topic nationally and globally during the pandemic. The issue has multiple layers of complexity, ranging from child, teacher, and community safety, debates and issues around vaccine mandates for children and or teachers, and so on. During the pandemic, over 1 billion children were affected by school closures, and at least 463 million children worldwide were unable to access remote learning during COVID-19 school closures and lockdowns in 2020. Worldwide, during the pandemic, there have been 1.3 trillion hours and counting of in-person learning lost. With these figures in mind, how do we balance the opening and closing of schools?
That's, as you say, it's been an issue everywhere, right? From every country of the world to I'm sure every community where your listeners live. It's been, and it's an emotional topic as well. We at UNICEF, one of the first things that we did was we said once vaccines were available, we said teachers should be considered frontline workers, and they should be right up there with the frontline health workers and emergency responders to get vaccines when they were first out, so that we could open the schools. Because we also felt advocated that schools should be the last to close and first to open. That if we're reopening, well, anyhow, if we're reopening all of our restaurants and everything, but we should be sure to protect schools first and make sure that they get open, and not, sometimes they were lagging behind, because the education loss, there is no question, all the results we're starting to see in Canada, let alone, and this is also in other countries, that children are, have lost a full year of education, that there are, only speaking here in my province, which is Ontario, and I know this because my spouse is involved in educational research. Basically, children who are in grade 2 have lost a year's worth of reading. Grade 1, where you usually learn to read. Now, what's that going to mean as they go on? And we see then the social loss, the social interaction loss that has happened as well. So we know we need to be safe for children, and we know that investments in and with the, because we're not so sure what Omicron will mean, but if if masks are going to help keep people healthier longer, then we should keep having mask mandates. We should try to encourage the ongoing vaccination of young children, and go for a pediatric formulation as well, so that preschools and daycare centers can be open as well. We those are open safely. We have to give schools a priority, which is right on the heels of that of our health system, I think. And excuse me, and that's going to be the way that we'll see schools open and stay open.
Moving on to child mortality. While the hospitalization and death rates for children are on the whole lower than for adults, there have been significant indirect effects on children, such as strained healthcare systems preventing sick children from accessing full medical care. Access to regularly scheduled immunization has been blocked or postponed, and antenatal care has now been affected. In your opinion, how are these indirect impacts of COVID-19 going to affect children now and in the future?
you know, every in 1960, so it's 60 years ago, we is when we started collecting good data on the global under five mortality rate. Um, every year, that rate has got lower. Like fewer children under five have died from preventable causes up to 2020, which is 2019 is the last year that we've got full data for. One of the huge reasons for that, the strengthening of health systems, but it's been the widespread access to immunization, to childhood immunization, and the further um, and the improvement in the development of those vaccines. So it seems to me logical, and we don't have all the data in yet from 2020, but with all of the children who have missed immunization, we weren't at 100% coverage, but we were very high global coverage for childhood immunization, and it's our statistics are that at least 70 million children missed out last year. I suspect it's more, but that's what we can see right now. It's going to mean that for the first time, that because of the pandemic, for the first time in 60 years, the number of children under the age of 5 who die from preventable causes is going to go up. That is another huge tragedy of the pandemic, because I have to say that that's in the context of the fact that in the last generation we have seen a child survival revolution. There's no question, that it used to be 30 years or so ago, the under 15 million children under the age of 5 died every year from preventable causes. And by 2019, it was under 5 million children a year. Now that's way too many, like 5 million children, like the heartache for those families and siblings and parents and grandparents is horrific. But it is only 1/3 of the number, right? It's down from 15 million to 5 million. So we've had this incredible child survival revolution. And it's been stopped in its tracks by the pandemic. And I think it is, I know for us at UNICEF, as we try to think, how are we going to be able to rev up the immunization programs again? Because those in and of themselves, it's not like it's, you in Vancouver and me in Toronto going as volunteers to do these things. It's working with local health systems, strengthening ministries of health, community health workers who are doing all of the immunization. We provide training and the vaccines, but we've got to start that up again. And the wonderful thing we see is that on very broad scale, as more and more children survive, parents start advocating more and more, and they don't have to be as afraid that their children are going to die. They start advocating for better education, and we start seeing parents pushing for more education for these kids, and so it becomes it's a bedrock of a positive cycle, and that's why that's why it's so terrible the way it's been affected by the pandemic, and why it's so important for us to get that started again.
Sobering. Right. David, so if we move to nutrition, looking nationally in Canada, in November 2021, I read a report that 60% of Canadians feel worried that they are unable to feed their families. Internationally, according to UNICEF, an additional 6 to 7 million children suffered from malnutrition directly due to COVID. On top of that, An additional 132 million people in the world went hungry due to COVID-19, of which 44 million were children. Clearly, the pandemic has added an additional burden globally to an already difficult problem of feeding our planet. David, can you please comment on the impact a poor diet has on the growth and development of a child?
Well, the issue of stunting is stunting and wasting when children don't get enough food is one that can have lifelong impacts if it goes on long enough. The those early years when there's and as a child is developing, as their physical and intellectual capacities are developing without enough food, then they don't get simply the fuel that they need. And you if we if it can be caught early enough and enough food and enough nutrients can go there, then children can recover. But if it isn't, it can have a lifelong effect on that child and as they become an adult. So it's one of the reasons why, like, we sometimes separate out health as a medical thing and nutrition as, I guess, a nutritional thing, one could say. But why we have to look at these holistically, because and it's why often in our, when you're in a rural clinic somewhere off the beaten track, we will see all of those coming together with nutritional supplements that we try to give at the same time as we're giving the immunization and so we need that as an integral part of healthcare for a child. Because if we don't do that, then even if there are educational opportunities for a child, they can't take full advantage of it, and that's a terrible loss.
And also, malnourishment of children impairs their ability to fight disease because their immune system is weakened too. Thank you for that, David. Another concerning impact in society is the mounting risk of violence and abuse during the pandemic. Families in total desperation have had to make unthinkable decisions in order to stay alive and feed themselves and their families. According to the UNICEF report, up to 10 million more girls will be forced into child marriage before the end of the decade due to COVID-19. Disruption in services related to violence against children was reported in 66% of countries globally due to COVID. Lockdowns resulting in school closures also put children at increased risk. There are so many variables to come out of these statistics that I thought I would ask you what springs to mind with regards to these impacts on children.
One of the things that we forget about, you mentioned this, the combination of the school closures and increasing poverty, because one of the things that schools do is their form of child protection as well, because the parents, when parents, if they're having to work wherever they're working, in fields and wherever, schools are a place where they know their children are safe or should be safe. And when schools closed, if parents still have to work, that's where they get, if they're able to find work. But that's where the risk of child exploitation increases if the children are left alone, if the children, and we see it. We see a direct correlation between schools closing and violence against children increasing, and what you mentioned, the early and forced child marriage going up. when schools close. So, I mean, that's yet another reason why we advocated to keep schools open as much as possible, because not only the education, but they do become almost the first line uh, defense against child exploitation and abuse. And I just think of various places where I've been fortunate enough to work, and I can think of teachers in countries as disparate as Ethiopia and Uganda and Sierra Leone, all saying to me, um, we know that the girls are safer when they're here and when they're with us. And so having schools as a place for child protection is really, really key, and why we think that keeping the schools open or as much as possible is so important.
Right. We're now moving on to the direct impact of COVID-19 on children acutely and long COVID. In Canada, the number of people 19 years and under with COVID-19 currently stands at around 651,000 out of a total in Canada of 3.2 million cases, equaling 20% of the total cases. So back in May 2020, this age group made up 4% of cases. Worldwide, with the Omicron wave of infection, we've seen a much larger increase in hospitalizations and deaths in children, particularly those under the age of 5, who at present in most countries are not or cannot be vaccinated. David, has UNICEF been called to provide support for increased medical services in low and middle income countries as a result of the Delta and Omicron wave to children?
We the way, because we work with ministries of health, what we're finding actually at the moment is much more, we're more of our efforts are still going into ensuring that immunization comes up and that vaccines are distributed. That's our part of the work, right? And those are the biggest requests that we're getting right now from me. It's around the issues of vaccine equity and vaccine distribution. It's with all the crises, going on in the world right now, it's just like any emergency room, we are triaging, and ministries of health, which are under pressure, are triaging and getting COVID vaccines and getting the routine immunization vaccines are really the immediate need right now. And I should, just thinking of vaccines, I know we're going to talk more about vaccines, but we are, and this may be off topic, but I just don't want to be only pessimistic about vaccines, because talking about non-COVID vaccines, there is this chance, of a malaria vaccine after all this time, and we're involved in the trials with that because we're a vaccine, because we distribute vaccines, and I think because of the impact of the horrific toll that malaria takes, if that works, well, then that'll be more than good news. That'll be excellent news, and I think that may counterbalance some of the difficulties that we're facing as a global society now, because vaccines are key these days.
Yes, and I think the malaria vaccine is particularly good. I think it has a 75%
Yeah,
efficacy, so that's
it's
fantastic.
incredible. It's incredible, and yeah, and the way malaria can dodge things. I mean,
Mm.
but anyhow, it's very good.
Wow.
Yeah.
Yeah, no, that is very good. David, with such a large jump in the proportion of pediatric COVID cases, long COVID in children is now a concern similar to adults. A previous guest of the podcast, Dr. Jason Maley, discussed a multidisciplinary approach to the care of adults with long COVID, involving a range of physician specialists and other healthcare professionals, such as physiotherapists, psychologists, OTs, for example, working as a team. Clearly, the multidisciplinary approach described requires skilled medics and support, as well as significant financial backing. Low and middle income countries will have higher SARS-CoV-2 infection rates due to a lack of access to vaccines. So how do you envisage these countries funding long COVID care for children?
Really, I don't know now how it will be possible, because, as I say, the triaging that ministries of health and departments of finance in low and middle income countries are going to have to deal with what they are facing. I think they're going to be dealing with other matters first, and it's not out of any callousness or anything. It's just, where can they make the biggest impact, positive steps forward for their country? So the kind of looking into those very real and very important issues of long COVID, I think are going to be, how those will be funded are still a bit down the road, and exactly how those are going to be working.
Thank you for your contribution. UNICEF is an amazing organisation, one of those who I would say are holding up the world at the moment. We are all thankful that you continue to be a great advocate and champion of children's rights.
Thank you very much for.
And I'd like to really appeal to the audience to please donate to UNICEF. You've seen and heard today of the amazing work and things that they do nationally and internationally, not just for children, but for adults. So people can donate by going to the website. Is that right, David?
Yes, that's right. Yeah. And here in Canada, it's unicef.ca is where people can go to make donations and be part of our global movement to improve child health.
Excellent. And yes, and I think it's unicef.org if you're
It's
listening.
the global one, and I know that you go around the world, so yeah, unicef.org is also the way. So
wonderful. And obviously those links will be provided on the show notes, so people can click on and go to those directly. So please join us for next week's episode called Vaccination of the Indigenous People of Canada and the Effects of COVID-19 on the Indigenous People of Canada. Thanks for listening to this week's episode of COVID-19 The Answers. If you enjoyed the episode, please subscribe, rate and review, and do visit our website kajalamedical.com/COVID-19 The Answers.